Miino, by Nutraverse. Miino contains myo-inositol, folic acid, vitamin D3, yeast selenium, zinc gluconate and chromium picolinate. It helps in the management of diabetes, PCOS, thyroid diseases, mental disorders, male fertility, fatty liver disease and other diseases. Diabetes. Myo-inositol reduces insulin resistance. Insulin is released by the pancreas in response to food intake. Insulin resistance happens when the body cells don't respond well to insulin and can't easily take up glucose from the blood. Different types of anti-diabetic drugs work in different pathways. For example, gliclazide stimulates the pancreas to release more insulin into the circulation. In the cells, myo-inositol is converted into second messengers such as IP3 and PIP3, which stimulate GLUT4 and increase glucose uptake into the cells. Clinical studies have shown that supplementation with myo-inositol 4 gram per day improved the insulin sensitivity, blood pressure, and cholesterol levels. In diabetics, myo-inositol depletion occurs in kidneys, sciatic nerve, lens, and retina. Myo-inositol supplementation delays or prevents diabetic nephropathy, neuropathy, and retinopathy. Polycystic ovary syndrome affects 1 in 10 women in their childbearing age. The underlying causes of PCOS are insulin resistance and hyperinsulinemia, which lead to increased levels of luteinizing hormone. High LH levels reduce production of estrogen and progesterone, increases production of testosterone, and inhibit ovulation. This imbalance of hormones contributes to irregular menstrual cycles and infertility. Hyperandrogenism leads to hirsutism, severe acne, and male pattern hair loss. Miino reduces insulin resistance and hyperinsulinemia, rebalances sex hormones levels, regularizes menstrual cycles, restores ovulation, increases fertility rate and reduces PCOS symptoms. Hypothyroidism, or Hashimoto's thyroiditis happens when the autoantibodies and immune cells are causing inflammation to the thyroid gland tissues, leading to reduced production of thyroid hormones. A study was conducted involving 86 patients with Hashimoto's thyroiditis. They were given myo-inositol and selenium for 6 months. The results showed that the TSH and the thyroid antibodies levels were significantly decreased. Free T3 and free T4 levels in the blood were significantly increased. The subjects reported improvement in their quality of life. Miino reduces thyroid antibodies and improves cellular signaling. Myo-inositol is the precursor of IP3, the second messenger of TSH. Myo-inositol is essential for the production of H2O2, which is required for the synthesis of thyroid hormones T3 and T4. Myo-inositol levels in the brains are lower in patients suffering from Alzheimer's disease, strokes, panic disorders, insomnia, major depressive disorder, suicide victims, and bipolar disorder. A study in 20 people with panic disorders has shown that supplementation with 18 gram of inositol per day reduced the number of weekly panic attacks by 4 episodes, more than the reduction of 2.4 episodes per week seen in individuals on anxiety medication. Myo-inositol is the precursor of second messengers, such as IP3, which are crucial for the signal transduction of neurotransmitters, including serotonin and dopamine. Myo-inositol has therapeutic effects in the illnesses responsive to SSRIs, such as depression, panic attacks, and OCD. Miino helps to reduce anxiety and depression. It has neuroprotective effects. It reduces neuroinflammation, improves cognitive functions and increases serotonin levels. Male fertility. In a study, 176 men with type 2 diabetes were given either 4 grams of myo-inositol plus 400 micrograms of folic acid, or placebo. The results showed that the combination of myo-inositol and folic acid helped to prevent or treat erectile dysfunction in diabetic men. This could be due to the supplement's ROS scavenging and nitric oxide protective effects. Myo-inositol, zinc, and selenium help to balance male hormones and increase sperm's count and motility. Myo-inositol reduces the accumulation of triglycerides in the liver. In animal studies, deprivation of myo-inositol in the diet resulted in fatty liver condition in rats. In animal studies, myo-inositol has been shown to be promising in the management of various cancers, including liver, lung, colon, and breast cancers. In conclusion, Miino helps in the management of diabetes, PCOS, thyroid diseases, male fertility, mental disorders, fatty liver disease and other diseases. The common dosage is 1 sachet of Miino, 2 times a day. For the management of mental disorders, a higher dose, up to 6 sachets per day, may be needed. Thank you for watching this video.